Hi, I'm Dr. Lydia Sosenko, practitioner and educator of dental sleep medicine and oral appliance therapy for the treatment of snoring and apnea. Today I'll be answering the question, how do I know if I have apnea? So we've talked about the seriousness of chronic snoring. If you're snoring often, I recommend a medical evaluation. Usually, if you've gotten to the point where you know it's time to get evaluated, start with going to your physician. Your medical provider will usually be the first place to start with. Make sure that you talk to him or her about any other symptoms you might have, if you do have any. A lot of apnea patients do not have other symptoms, but some do, like unexplained sleepiness, morning headaches, daytime sleepiness or poor sleep quality, but many apnea patients don't have any of those. Start with your provider. Usually he or she will either administer a test through their own facility, or very often they'll refer you to a sleep testing facility or to a sleep physician of somebody that's educated in sleep medicine. And most often than not, they will prescribe a sleep test. And there's usually a couple of the most common types of sleep tests is either a home test, which is you are hooked to a monitor at night while you're sleeping, and then you drop off the device the next day or two to your facility, and then they download the information. Or the gold standard of care is actually a polysomnography, which is a sleep test at a sleep testing facility, a lab-based sleep test. And with that, they'll give you a lot more information as to the quality of your sleep, the position of your sleep. It's monitoring you in a sleep environment. So usually it'll be one of those two tests. Now, some people do start with a home test, and if it's found to be inconclusive, then they might be prescribed the other type of test, or they might send you right for a lab sleep test. Which test is prescribed is usually determined by what other medical conditions you might have. Also, insurance might dictate which way you might need to start, so there are some insurance guidelines that might need to be followed. And sometimes the preference or knowledge of the medical provider might kind of scoot you one way or the other, or access to care. So those are usually the most common things that might influence which test is prescribed. They definitely both have their pluses and minuses. If you do have a lab test and it is found that you do have apnea, it is not uncommon for them to awaken you up partly through the night of the test and to try a CPAP machine, which is the most common treatment for apnea. And not to be alarmed, you could try other treatment options, but while you are there, it is a good idea to try that if you've reached that level where they actually waken you up. So, one thing important to remember is whichever sleep test you have, please have a consultation with your medical provider to discuss treatment options and to discuss details of that test. Sometimes there's a lot more that could be discussed than just the summary of the test, which I will talk about in future videos. So those are usually the most common ways to find out if you do have apnea. So if you're snoring chronically often enough, whether you have other symptoms or not, start that medical visit and get started to your path to great sleep and rest. If you like and share this video, it can help save somebody's life. And if you have any comments or questions, feel free to write them in the comments section. Thank you so much.